Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about a very specific niche topic about constipation right after postpartum. This situation comes up more than you'd suspect, so I decided it would be important for a video. Most of us have routines of how often we have a bowel movement. It can be normal to do it every day or a couple of times a day or once a week. Those are kind of the extreme ranges for normal, but most people, once a day or once every other day, something like that. That can be altered when you're pregnant. But if you're used to having that pattern can change right when you're postpartum, which can bring you some concern. So if you normally have a bowel movement once a day, the take-home message is once you have a baby, especially a vaginal delivery, you frequently will not have a bowel movement for 2 or 3 or 4 days. And that can be concerning to some women and lead them to believe they're constipated when they're not, okay? And that's the reason for this video, because I don't want you to inadvertently chase the lack of a bowel movement with Miralax or with laxatives. So here's what happens when you have a baby. Especially if it's vaginal, you clear out your intestines. So if you have stool in your colon, we all have bowel movements, but when you have the baby, it gets cleared out. So that's one thing that delays when your next bowel movement is. The other thing that happens is your uterus has been packing your bowels away, and now that it's deflated and the baby's gone, there's a lot more room for your intestines. And so it takes longer. There's a delay before you eat enough to produce enough stool to have a bowel movement. That also causes the delay on the pattern you've gotten used to. And another thing is pain medicines, especially narcotic pain medicines, can slow down the transit time of your intestines and delay when you have a bowel movement. And they can also lead to constipation later. Watch for that later, especially if you have a C-section, when you get more medicine. But initially in the hospital, the first or second day, if you don't have a bowel movement, it's more likely because it's not ready and you don't have one to come. You're going to feel some cramping. And that cramping gets confused for the sensation of constipation. Makes you feel like, I have to have a bowel movement. But that cramping is your uterus cramping. It's shrinking. Your whole uterus was that big. It's got to get to this big, and it does that over the next few weeks. So the change in your body, the delay of the function of the intestines, the evacuation of your intestines, all of that causes a delay. The cramping fools you into believing potentially that you have constipation when you don't. And so if you drink Miralax or you take a bunch of laxatives, you're treating the wrong issue. Now, that's a generalization. It's something that I've observed over the years. You might be the exception. You might have other reasons why you're constipated. Maybe you had a C-section. Maybe there are other circumstances. So before you start requesting all of the laxatives or doing it yourself, that's something to consider and to discuss with your provider. Okay, so I hope you found this of value, and please leave your comments. Thank you.